Hey everybody, it's Dr. Dave Psychiatry. Just jumping on here real fast to answer a question that I got in the comments section. So first of all, thank you for going to the channel. Thanks for commenting. I've sort of learned that I can try to answer some of the comments in typing, but some of them are actually sort of need a little bit more of a verbal response. So in the same way that I would be talking to somebody in my office, the beauty of YouTube is I can just answer the question here. So I'm going to read you the first one I'm going to cover today is it's from the Getting Help for ADD and ADHD YouTube video that I did, and she starts off with thank you and asks the question, how can you truly get tested for ADD or ADHD without people thinking you're just after meds? I have a really hard time with being late no matter how many timers I set. My husband also keeps telling me that my time management sucks. Sorry that he said that, but for example, I need to cook dinner, but in order to cook first I must reload the dishwasher, but I got distracted and somehow ended up watering plants on my porch and came back to find I had left the fridge door open and the cabinet doors open. And that's just one of the many things that makes me wonder. So without going back through the symptoms of ADD and ADHD, which is in that video, I just want to say that, easily distracted, not keeping track of stuff. This sounds like it's legitimate. This person should have that concern and you should talk to your doctor about it. The questions she raises that really needs to be answered, not in the type form. The reason I want to jump on the video and do this is that there are people that come to me, have come to me and have said to me, Dr. Holmes, I hear you'll give me Adderall. I had one guy tell me, he came and said, hey, listen, I had friends tell me that I could come here and I could get Adderall. So I just want you to give me some. I asked the guy if he was serious, and then I politely asked him to leave and I gave him his money back because I'm not a source of, controlled substances for people. If you have a legitimate concern, if you have symptoms and you want to be treated for those symptoms, I think it starts off with, to answer the question of the person with the comment, it starts with your sincerity about asking for help. Your question was, how do I get help, or how do I, you actually asked, how do I get tested? You get tested in the same ways that you can get an online form and check off the box and hand that to your provider, internal medicine, family doctor, pediatrician, if that's appropriate. But the issue there is once you've got a score, once we know you have those symptoms, or if I just verbally ask you the questions and you give me the answer, well, there's enough concern there to offer some type of treatment. The question is, how do you come across as not seeking drugs? And I think the best thing to do is be sincere about your care and have a relationship with someone and ask reasonable questions. And in fact, to start off with, hey, I've got these symptoms, but I don't want you to think that I'm just drug seeking. I really want help for those. Now, you're going to have to adhere to whatever policies they have. If they have a pill count policy, if they have, if you need to show up a certain time and produce a urine that has that your medicine is in your urine, some offices do that. Sometimes we do that. Sometimes we don't do that. The issue is that if you are sincerely asking for help and you comply with their policies and do your best to do the right thing and take whatever medicine they offer you, then I think that a reasonable clinician that wants to help people is going to listen to you and is going to try to help you. If you come in with a strong agenda and say, look, I've heard that this medicine is great and that's the only one I want, well, that's not exactly cooperative. When I hear that, I feel like that's the person's got an agenda. What I like to hear from a patient is, I've got these symptoms, they cause me problems. Dr. Holmes, what do you think? What do you think I should be doing? And that's where the discussion and negotiation comes back and forth about, what does the picture look like? Would you be better off with a release agent, a medicine that spits out norepinephrine quickly, or something that you can take routinely, that the timing of it doesn't matter so much? And I talked about in the other video about the difference between the release agents, so the Adderall group and the methylphenidate group versus the Strattera and Wellbutrin group, or bupropion group that we believe cause increased overall activity of the norepinephrine system. So again, this answer is really not about the chemistry. This answer is about, how do I get help without appearing to be drug seeking? And the answer is, be a good person. Don't be a liar. Don't be drug seeking. if you're watching this going, I'm going to figure this out and I'm going to go see if I can get some controlled substances out of this guy. Well, we end up finding out. We end up knowing that you guys are doing that. So I wouldn't believe you're watching this video if that's what you're trying. If you are, it's not going to work long term. For the people that are sincerely asking themselves, I don't want to, or saying to themselves, I don't want to appear drug seeking, but I legitimately have concerns about what I need. That's really no different than if you've got terrible pain and you have to say, look, Dr. Jones, I've got terrible pain and I need some help with the pain. That's completely different than walking in and saying, hey, I want 120 hydrocodones today. I mean, there's a difference in how you approach your treating clinician is really, I think, going to make the difference. So even though the test is pretty simple to the commenter and sounds like you have the symptoms, I think you need to simply go to your primary care person, whoever that is, if it's a PA, a nurse practitioner, if it's internal medicine, family doc, if it's a pediatrician, if that's appropriate, even OBGYN, if that's right, or your psychiatrist, if you have one. It's legitimate to go to them and discuss your symptoms and discuss the best treatment program and plan for you without simply saying, hey, give me drugs. I think you don't want to say that. I think you come to me and you say anything that's has the feel of, hey, give me drugs. I'm going to say, I don't think so. But if you come to me and say, I'm suffering, here's my symptoms, here's what I need to do. Dr. Holmes, what do you think? What can we work out to help me? And what type of trial can we do to see if it works? That's the approach I encourage. So that's a long answer to a short question, but it was way too long to type. So that's why I wanted to do it on the video today. So thanks for coming to the channel, and I will post that this question is answered. And again, I appreciate you, all of you who have subscribed. And if you like and tell other people, that gets the word out, and other people are able to get practical, useful information from a full-time working psychiatrist. All right. So thanks for being here. I'm Dr. Dave. Thanks for coming to see me.